I'm a police officer with the Houston Police Department and one of two full-time instructors within our mental health division at the Houston Police Department. I work with my training partner and we train officers and cadets and public members of our community on crisis intervention. Crisis intervention training is extremely important to officers and people who are working in law enforcement. It provides another tool, if you will, in an officer's tool belt in how to handle someone who's in crisis. It takes a very different approach because it focuses more on verbal de-escalation skills rather than hands-on. The idea behind it is actually twofold. It's keeping our officers and citizens safe during these encounters, but also helping to provide a more humane response to people who are in crisis. Traditional police training doesn't provide for a lot of patience. You know, we're very busy, we're very engaging. Traditional police training is more hands-on. The crisis intervention training explains the process of how the frontal lobe begins to shut down when someone goes into crisis. And so the use of verbal de-escalation skills become very, very important. Engaging the person, establishing a rapport, and getting them to calm down physically helps them to focus more on what's going on and helps to make for a safer response. It keeps not just the officer safer, but it also keeps the individual safer. We believe that it's important for agencies to be able to adapt the training to fit their needs. You know, every community is going to be a little bit different. Every law enforcement agency is going to have different resources and capabilities. We offer the training and then we allow them to take it and make it work for their agency. The role plays are completed on the fourth day of the training because we want to give them as much background prior to actually putting them in a scenario. Typically at the beginning of the week when we tell them how the schedule is going to be, people are pretty nervous about doing the role plays. Usually by the end of the week, people are telling us that that was their favorite part of the training. They are able to actually engage. We have paid actors within our department. They get their scene information from actual incidents that we've encountered, and then they are given artistic license to, you know, kind of go with it as an actor would. We pair the officers up into partners, and so we send 2 to every scenario. At the same time, we have a facilitator, someone who has been trained and has had plenty of experience in dealing with these situations, who will watch the officers engage with the person in crisis. At that point, they'll let them go for, you know, a period of time engaging and trying to de-escalate the situation, and then they'll stop the scenario and they will give them verbal feedback on what they did well and things they might want to reconsider. The idea behind the scenarios, the role plays, is that if they're going to do something that's not exactly in line with what we've been instructing, we want to give them the opportunity to do that there so that they can get that feedback and replay the scenario. When we do the training with officers, we want to give them education and information, but we're very clear with them that we don't want them to go out and try to diagnose people on scenes. We want to leave that for our mental health professionals to do, and that's one of their most important roles, is to help get those people properly diagnosed and into treatment. But that is not the law enforcement officer's duty. We want them to go out and intervene in the crisis, settle the crisis, and then move the people over to the appropriate levels of treatment and care. Coming into the crisis intervention training with a law enforcement background as well as a behavioral health background allows for a different level of expertise in doing the training with officers. Officers oftentimes are more open to someone who's been out there doing the same job that they've been doing. And so it brings in a different level of credibility when they're getting the information from someone who's actually in law enforcement. They may start out at the beginning of the week with their arms folded and very closed off to the idea of getting the training. And oftentimes by the end of the week, they're coming up to us asking us about someone they know. It may be a family member, it may be a friend, it may be a scenario they encountered on the street. Sometimes we get feedback from them weeks or months later telling us that they didn't realize how effective the training had been for them until they actually encountered a situation. They often leave with a different sense, and many of them are very thankful for having the experience and having the training that they've received during the week. It's real important for us as trainers, or for myself especially, to know that they get something out of it. And it may not hit them right away. It may be that little seed that we've planted that will grow later on through some experience. And hopefully it'll be something that keeps them safe and something that keeps our community safer.